This podcast is brought to you by Optimizer's Mass Zines product. Watch the video at the end of the podcast for more details.
Welcome to the Deepak Saini Show.
Welcome to the Deepak Saini Show. I'd like to thank J23 for her intro music. You can find a link to her music in the show notes. My guest today is Torkil Færø. Dr. Pharaoh is a GP and emergency physician, documentary filmmaker, author, and photographer. Over a 26-year career, he learned that the cause of most disease is often found in the stresses of our lifestyles that we place on our bodies. When his father died at 73, he realized that he had to change his own lifestyle. Being 40 pounds overweight, overtrained, overstressed, overslept, and drinking alcohol every day, he learned that his lifestyle could deprive him of decades. Using wearables, he found a way to track and regulate his nervous system and physiology. He's an award-winning photographer and author of The Camera Cure and The Pulse Cure, his latest book, and we're going to be talking about that. Torkil, welcome to the Deepak Saini Show.
Thank you, Deepak. It's great to be here. Thank you.
Yeah, thank you for being on the show. So I like to always start off with maybe a little bit, I touched upon it a bit in your bio, but feel free to go as far back as you like to go, as like what got you to doing what you're doing today.
Yeah, that's probably a long story. I started my medical career actually as a way to be able to experience the world. I knew it was a free kind of job in Norway, as I also know it is in Canada. I was actually inspired to become a medical doctor in Canada because I heard that you could work in the northern areas for like half a year and then go off traveling somewhere. You know, you had earned enough for that time and then you could go travel the world. So that was actually part of the reason why I thought, okay, I can become a doctor. I'd like to work like that, to have a free life where I can do interesting things both in my profession, but also have the time to go and explore the world because I love to travel. And I was actually, as you mentioned, my father died at 73. And at the time, I was just about to pass with my family through the Panama Canal. We had been sailing for a year and there was supposed to be 3 more years of sailing to come. But then my father died and we had to pack up the boat, leave it by the Panama Canal and head home. To watch my father wither away, you know, from cancer. And I took a look in the mirror and I saw that I did not exercise. I weighed 40 pounds more than I do today. Did not really care about my own health, even as a doctor. But then I understood that if I will be able to explore the world and see all the things that I would like to experience, I would need to live longer than those 73 years. So I just, changed my lifestyle totally around. So that is now 12 years ago. And started to update myself on preventative health, how to stay healthy, because that was not on the curriculum as a medical doctor. We learned how to categorize and treat disease. And we did not learn too much about sleep and nutrition and exercise and all of the things that we now know is so important for our well-being, including sunlight and circadian rhythm and all of these things. So it's been kind of a medical study 2.0 that I had to do in my spare time. And in the later years, the last 10 years, I also been writing books in Norway, and The Pulse Cure has been translated into 8 or 9 languages, including English. So it has been, part of the journey to suddenly become an author, because I was not an author earlier. I did not write anything from high school, or university until I started writing books. So
right. Torkil, I want to interrupt you there. I think you bring up an interesting point, and this is a topic that's come up, a few times over the years of the podcast, and I can certainly relate to that. When I was, the audience mostly knows my story of losing 100 pounds. When I was sick and unwell and overweight and trying to figure it out, before I took matters into my own hands, I was trying to listen to my GP here in Canada. And then I look back and it's like, why would I be taking advice from someone who's overweight and, you know, skin is bad, everything. So, you know, I think you made the interesting point there that, you know, even, you know, yourself as a doctor and probably some of your colleagues, and certainly all over, probably worse in North America than it is in Norway, you know, a lot of the physicians are not the pillars of health that they should be for the community. And I don't know why, I mean, you kind of touched on
Yeah.
it, you don't really learn those things, but why do you think that is?
I think we are trained. When I study, I certainly had the idea that, okay, you live your life, and whether you get sick or not, it's just a matter of genetics or bad luck. And when you get sick, then the doctors have pills to treat you, or they have surgery, and there's not much you can do about your lifestyle. Maybe you could be able to gain 3 or 4 years, but that would take you 3 or 4 years of exercise and more sleep and so on to be able to do that. So so it felt like why bother? So
Got it.
I think that's part of the reason.
Yeah. So Torkil, you mentioned, and I mentioned at the top, your newer book, The Pulse Cure, you know, so which is really about, you know, pulse, heart rate, that sort of thing. Can you maybe explain to the audience, you know, how does the heart rate reveal, you know, kind of like how our state of health is?
Yeah, the good thing is that the heart rate reveals the kind of strain on our bodies, whether we are too much stressed, how we are sleeping. So the heart rhythm is kind of a gauge, just like you have on your speedometer, to show the intensity that is put upon you or you put upon yourself. And that is, of course, something I use at the ER every day. When a patient comes in, I look at the heart rate. Is it high or low or normal? I know if the patient has a heart rate of 60 or 70, I know they're quite good. If it's 100, 110, okay, I need to watch out. You know, there's a quite sick person here. But it's also important on your everyday life. Because over time, whether then you have, for example, 60 in heart rate or 65 would amount to something. And we also have a more, I would say, sophisticated way of measuring your heart rate, which is heart rate variability,
Yeah, I was
which
just
is,
going to ask about that, so please continue with
yeah,
that.
yeah. So that is, I consider it is like watching your heart rate with a magnifying glass. It is so much more sensitive to change. And it's also a measurement of the state of your autonomic nervous system, whether you are in the stress sympathetic state or in the parasympathetic recovery state. And one of the root causes of disease is that we, as humans, are being way too much in the stress sympathetic state than the parasympathetic state, than we are constructed to be throughout evolution. We're supposed to be stressed, you know, or active maybe 2 or 3, 4 hours a day, and then be quite restful the rest of the day, and certainly during nighttime to be recovering in the dark. And of course, now we live our lives very different from that. There's too much stress, you know, throughout the day, even into the night with artificial lights and so on. And this stresses us out and will make sure that and make for that our immune system is not prepared to do its job. So that is why many of the patients that will come to me, they will have a unbalanced autonomic nervous system. And that is why it's
Sure.
so important to track the heart rate variability. That gives you insight into that. And that is what my book, The Pulse Cure, is all about, to try to find the right things to do when it comes to nutrition and sleep and exercise and stress management and alcohol and many different things
Yeah,
that will
I
affect
want
our
to touch
stress
into those
levels.
few things, but it just reminds you of something. I was actually just having this conversation with some family members just a few days ago, and we were talking about, you know, this thing, you know, that we all carry around with us. And, you know, my sister-in-law was like, oh, well, you know, and she's got an Apple Watch, so she can, whether it's on her phone or on her wrist, she can see, you know, every time she's getting an email or a call or a text or whatever. And she said, oh, I just look, and if it's not important, I just disregard it. I'll deal with it later. That doesn't stress me out. And really, like I was making the argument, no, every time you get a notification, it's that signal of, you know, it's not the proverbial saber-toothed tiger jumping out for our, to kill our ancestors, but it's still a little stress response every time we get stimulated like that. And I don't think people don't realize that you said maybe 3-4 hours we're like having to hunt or exercise over, but we're stressed out all day long because of things like this and everything else, right?
Absolutely. It's like we're always on call, just like a doctor. There's always somebody that can reach us. And of course, when I became a doctor, it was only the doctor that had these kind of, devices that could
Right.
beep you,
Pagers and stuff.
pagers that could beep at any time, and you would have to do something.
Doctors and drug dealers, right? Those are the only ones.
Yeah, probably. We had the pagers. And now everybody has that. And what I'm using a Garmin watch, and what the watches and your heart rate shows is that even when you think you are relaxed, you're not relaxed deeply enough to get into the parasympathetic state that your body really needs to be. So it's like it's like if you have on your stove that you are not totally off. You're kind of simmering, at all
Right.
times.
That's a
You're
good
not
analogy.
going, you're not totally turned off. And we need to turn totally off, from parts of the day to be able to relax totally. And when you can see that measured in your heart rate, that your heart rate variability is so good that you are in the parasympathetic state, it's much more easy to manage and navigate your stress. And most people will be surprised by what it takes. And it takes some effort to reach that level of, to stress down actually.
Yeah. So you mentioned you use a Garmin, and obviously I don't know if you're wearing or it looks like an Oura ring there. I'm not
An
wearing
Oura
mine right
ring and
now,
a
and I'm
Whoop
not wearing any
band.
device. Yeah.
Yeah.
So, what, maybe just briefly, I think people are kind of getting the idea, but what's the benefit of tracking these? And let's not get into like what's the best one or whatever, I think, but like the benefit of
Yeah.
using wearables as a way to gauge your health.
They keep track of your heart rate and your sleep while you're busy living your life and being asleep, of course. So they can tell you something about that is not so easy to sense yourself, because we have excellent senses from the outward threats that has historically been our problem, right? From other animals that wanted to eat us. And so we have excellent eyesight, excellent hearing, excellent smell and taste, because, the threats to our lives and health came from the outside through all the millions of years. But it's only the last, few decades that the threat to our health is coming from inside us, from too much stress and too low capacity also. We are undertrained, and we don't have as good mitochondria and cells that are able to fight disease and to fight cancer, that constantly will come into our bodies or start in our bodies. So I think this balance between our capacity and the strain that is put upon us, makes us sick, gives us those lifestyle diseases that I see every day as a doctor. And these devices then will track your heart rate, and it will tell you whether you are living a life with the intensity that is sustainable over time and compatible with health over time. And of course, one thing is that you, to a larger degree, will avoid disease, but you'll also feel better when you manage your stress in a better way.
Absolutely. I have so many questions, but while we're staying on the topic of sort of tracking and wearables and everything like that, I've heard you say that it's even more important for women to track. Can you just touch upon that a little bit?
Yeah, so many of these stress-related diseases like fatigue and brain fog and muscle pain and is more common among women to have stress-related diseases. So most of the readers of the Pulse Cure and most of the people who are using or the wearables for health reasons, they will be women because it's more important for them because of the hormonal differences throughout the menstrual cycle when they are in the fertile age, but also when they go into perimenopause and menopause. It becomes much more important to have a good stress management because those certain parts of the menstrual cycle are stressful in itself. So the week before menstruation, many people of the women can see it's a strain that is as tough on their physiology as a hard COVID infection the week before menstruation. And when you see that, what you feel that you are, maybe irritated, you have some symptoms and headaches, and you just feel bad. It's not just a feeling. You can see it in the heart rate variability that this is a strain on your system. And once you can identify that, and once you know then what to do about it, to sleep better, avoid alcohol, maybe avoid the comfort foods that, makes you feel good, but that will add stress to your already stressed situation. When you do that, you can flatten that curve and you will feel better. And the same once you get into perimenopause and there will be stress from that, then it's also important to be able to identify that and to be better at stress management.
Yeah, you brought up something that reminded me. I think again, depending on whatever wearable, I prefer the Aura. But any wearable that tracks your temperature, again, especially over time, I have found myself that I run kind of, let's call it cool normally, but if my body temperature is starting to rise up even just 0.2, 0.3 degrees, it is an early indicator of like, oh, I'm stressed, something's maybe coming on, I need to dial it back, dial back the training, maybe up the vitamin C or the zinc, depending on time of year, that sort of thing, and actually like cut it off at the pass so I don't actually get a cold or something like that. So maybe you can want to talk about it. I think this makes a good connection between just in general, but maybe specifically for women as well as tracking body temperature.
Yeah, so temperature, of course. So these devices, the watches and rings and armbands, like I have the Whoop band, they will track temperature, heart rate, your rate of breath, your oxygen level, and your pattern of movement. And all of these are important metrics, right? At the ER, of course, I use the rate of breath and I use the oxygen level and the temperature and the heart rate, so that you have these biometrics accessible in your hand and then compared to millions of users, through these manufacturers and through artificial intelligence that can interpret these numbers and tell you what does this means to you, to your system, because they are calibrated to your system. That is, of course, invaluable information. So, and that you have the control and not only the doctor, because that used to be the case, right? 25 years ago, the doctors had all the answers, and now you get the answers, and that is such a big change in the healthcare business where you are able to become master of your own health.
I think that's a great segue to my next question, which was going to be, I've certainly been a proponent of this. Many of our previous guests, you are as well. Sort of, the future of medicine being not only preventative instead of reactive, but more of personalized medicine as well. So I'd love for you to maybe touch on that. Maybe medicine 2.0 or personalized medicine or whatever you want to call it.
Yeah, right. Yeah, I think Peter Attia calls it medicine 3.0. And that is when medicine becomes personalized and becomes preventative rather than reactive. And these devices that I'm talking about in the Pulse Cure, they are personalized in the way that they show how you react to a certain thing. Because you may react to gluten while your wife or your children may not. And so, the way we all respond to alcohol, for example, will be different. Some can tolerate it better than others. And you can see how much exercise can you take, because that depends on your basic fitness level. And from your heart rate, these devices can tell you whether the last training session was too hard for you or not. So it gives you individualized answers that you can use yourself. And of course, it's useful for your doctor, if they know what this is about, to be able to look at your results and give you personalized feedback on what you need to do. Some people sleep bad, for example. on Instagram, I get all these questions every day. And for example, suddenly you see that your sleep is bad. You are stressed during sleep. You don't know why. So maybe you have sleep apnea, for example. Maybe you are eating too late at night. Maybe you do just like I used to do, have 2 or 3 glasses of wine in the evening to relax and wind down and sleep better, or so I thought,
Right.
until I got these devices that show you that that is actually the worst thing you can do for your sleep. So that kind of tells you how hard it is to know these things, that the thing that I thought was best for my sleep turned out to be exactly the worst. And according to Whoop, that gathers information from all their users, what they are doing, then alcohol is the worst stressor of all the stressors. And I know so many people use it to wind down and relax, right?
Yeah, absolutely. You bring so many good points there. So first of all, I'd just like to say, like, I'm always a proponent of saying, test, don't guess. And I've done a podcast on before. I've done articles. People, audience, you can go back and check out things. When I, tracked for 4 years using the Aura Ring and like all the data I collected and all the big inferences, I came up with that. So I won't rehash that, but I just want to go back to this test, don't guess. Example, I know, genetically I'm a slow caffeine metabolizer. So I hear people say, "Oh, I can drink a cappuccino and go right to sleep." Yeah, I can too, but that doesn't mean my quality of sleep is going to be any good. It's going to be terrible. You mentioned alcohol. I found that for myself. Even one glass, doesn't matter what, red wine, white wine, a spirit, whatever. Even one glass affected my sleep, and certainly 2 or 3, trash sleep. So again, I think it's whether be tracking a wearable or doing some advanced testing that's not kind of the basics that's covered with most healthcare plans. I think it's really important to get to know our again for medicine 3.0 in personal health. I've heard you say, and I want to spend some time on this. You have your top 8 strategies that will give us an extra 24 years of life. So I have a publicly stated goal to be a centenarian. A lot of my clients want to, it's not always about lifespan, it's about health span, right? Like how long we're healthy. So I love to hear, and I know the audience would as well. What are your top 8 strategies to give us some extra years?
Yeah, so this is the result from an American study on US veterans. And they found that you're talking 24 extra years if you do these things right from you are 40 years old. And the good thing is also that the things that makes you live longer also gives you a healthier life while you are alive. That's really, really important. So it's the same thing you need to do to have more well-being, to be more healthy, and to live long. Is exactly the same things. And if you do these things right, then you live at 24 extra years on average, right? So this is a statistical number, increasing your chances of having a long life. And those strategies are more or less exactly the same as I have in the post-cure talking about. The only thing that I don't have there is the opioids. So one of the things that you need to stay away from is the opioid painkillers, which of course is a more US problem, with the opioid crisis and all of that stuff. But the other 7, that would be to to exercise, to have a good fitness level. It would be to eat nutritionally well. It would be to not be overweight. It would be to have a good level of sleep. It would be to have a good stress management. It would need to not be smoking. That is another thing. You need to have good relationships. That's also very important.
I think
So,
that's one that, if I could just interrupt, I think that's one thing people totally miss when it comes to health. They think that's not important. And, you said like this study, many studies shown, blue zones of happiness, Dan Buettner's book, they did tons of studies from there that like our personal relationships and the lack of, or lack of conflict or more cohesion in our personal relationships benefit our health for sure. So I think that I just want to underscore that because I think a lot of people don't discount our relationships or interactions with others when it comes to our health. We just think our physical, what we can exercise or what we're putting in, and not that thing. So anyway, I just wanted to share that. So please continue.
Because our bodies, our minds are stressed by being lonely, because many of these things points to the importance of our, basic function. So we are intellectual beings. We have gone to the moon. We have invented things that makes this possible, that we can talk like this, cars and planes and whatever. We have used our intellectual brain, the prefrontal cortex. But what is in the way of health is often the basic system in our health, just like in your car, everything that goes on under the hood. It doesn't matter how, all the electronics works if what is under the hood is not working properly, right? We're just by the roadside and can't go anywhere. And our bodies are somewhat like that as well. So in our minds, being lonely is dangerous, and that's the worst thing that could happen to you. 100,000 years ago, you would in practice be dead. Just another animal would
Right. If the tribe
take you first,
the
right?
tribe kicked you out, you'd be basically dead within a few days, right?
Yeah. And parts of our brains still functions like that. You're lonely, and that is stressful. And that was a surprise, something that we did not learn in medical school, that if you're lonely, is as dangerous as smoking, right? It could take 10 years away from your life just because you're lonely. And it's not because of, mental problems. It's because of cancer, heart disease, autoimmune diseases, all of these things. That is not just mental things, because during our medical study, we were taught that mental diseases is one thing and physical diseases is a whole other thing. Now we know that it's intertwined, right? There's no separation between those. Whatever makes you depressed and anxious and feel that you're living a meaningless life will also give a result in physical diseases like heart disease and cancer and so on.
Yeah, I think I just, before you continue on, I think everyone listening or watching probably knows at least one person, if not more, that when, an older couple, maybe it was your grandparents, maybe it was your parents, that when the first spouse died, the other one passed within short time, like less than a year. Like this happens all the time. And I think right. It's the depression, suppression of immune function, etc., because of the loneliness, because of the mental factors, that then the physical manifestation would be cancer, whatever comes up, that takes them eventually.
Yeah.
Yeah.
And so what is good about those extra 24 years when you're 40 is that even if you are now 60, and listening to this, the good news is that if you start when you're 60, you get 18 more years. And that will in practice mean that you double the rest of your lifetime, even if you start from scratch, when you are 60. Implementing these changes, starting exercising, starting caring about your diet, making sure that you have good relationships, making sure that you're sleeping, that your alcohol is minimized, I would say. Of course, cut smoking and these kind of things. And that is quite hopeful because we have much more impact over the quality of our health than I was trained or learned in medical school. And it's a good thing that instead of all the money being on the backside of disease, with these wearables and preventative medicine, you have financial gains from helping people avoid getting sick in the first place. Because the problem is that there's too much money to be made on sick people.
Right.
It's a lot harder to make money on healthy people. All of us doctors, all of us practitioners basically we're waiting till people get sick and then we do something. And that is not sustainable as a healthcare system. And of course, both in Norway and in Canada and the US, of course, we know that so many people, they are not waiting for the healthcare system to change. They change their lifestyle themselves, which probably most of your listeners and most of the listeners on the podcast that I'm on are already aware of. What they may not be aware of is that the things they need to do, you can measure from your heart rate, from these devices. You can see that you're on the right direction. which makes it so much easier and more motivating to do the right things. Maybe to do some fasting or intermittent fasting, restrict your feeding window, do cold water therapy. When you can see the results, it's so much more easy to be motivated to do those things and make the effort when you can see it. And it's not just a hope for the future that will come, but you can see the results right here and now as you go.
Right. And I'd like to get your take on this as we slowly start to wrap up here. I always tell people, it doesn't really matter what device you're using for tracking, or even if it's just your weight or whatever. Even if it's, what's the most accurate, which is the best one. My view, and I'd love to get your take, is like, even if it was like 10 or 15% off, if you track over time directionally, you'll be moving in the right direction. So whether this device is more accurate than this one, I think it doesn't really matter, because once you have your base, you've established your baseline, as long as you're making improvements, you're moving in the right direction, whether that baseline is off by 5 or 10%. What's your take on that?
Yeah, I would say that most of the trackers are good enough and will help you so much better than your own guesswork, which is really terrible. We are terrible at guessing what's going on. We're just not equipped to do that very well. So I think all of the devices will be a huge step up. But I would say that Aura, Whoop, and Garmin would be the best choices. And depending on how much you want to micromanage your stress, from hour to hour or minute to minute, then it would be Garmin that is the only choice for you to do that. But both Aura, Whoop, and probably many other devices will do the job. So some are more intrusive than others. So if you have a screen, okay, then suddenly you start looking at your heart rate, often you may want to do that or not want to do that. If you have a ring or a band, you check it in the morning, maybe in the evening, and it's less invading in your life. But some people may really need that, hour to hour tracking and finding out that, okay, it was the meeting with this particular colleague that stressed me out, and it stressed me out that much, or it was the meal I had at 4 o'clock containing chili or gluten or whatever food intolerance or trouble you have with some food stuff. That was a problem, and it was maybe not something else that you thought it was. So
I think that's a good point, that for those people to really dial it in, you might want to check more frequently, like you just suggested. But at the same time, I think some people can become obsessed, and that becomes a stress in itself, and they're like over stressing, checking on the side. I don't think that's good either. Right?
Exactly. Yeah, exactly. So
that,
there will be pros and cons with all of these devices, just like with your car. Some cars are maybe you want a fast car, or you want a big car, or to have put loads of stuff in it, or go camping or whatever. There's different devices that suits different people's needs, I would say.
good
But
point.
but there's one thing that, okay, many people will be disappointed when they see their stress levels, right? They will see that they are too stressed and that their capacity is too low to deal with the stress. Then it's not a good idea to throw away the device, right? Just like I compared to your car. So suddenly because this is like getting a dashboard to your physiology. And if you're in your car and you see all the alarm signals flashing, you're low on oil, your temperature is high, your tires have too little air in it, or you're low on fuel, or whatever. And there's a warning saying, okay, to go to your mechanic, stop your car, which is comparative, to what these devices would say about you if you
Right.
are too stressed, right? You need to rest. Then of course the mechanic would never say, okay, just take out the fuse and all of these alarm signals will stop flashing and you can go on. So they wouldn't say that. And I will say also the same, that if you see that you are too stressed on your device, it's just a reality check. It's showing the load on your system. And for too many people, probably 80% of the population, it's too much. And maybe many people like yourself, you would be able to do minor adjustments sleep a little bit more, restrict your feeding window, skip alcohol, maybe just drink once a week and so on, and suddenly you're on the right track. That's enough. But other people, they would need, substantial effort to be able to balance their lives right.
Yeah,
The alternative would
everyone's
be to get
individualized.
sick. Yeah, yeah.
Absolutely. Yeah, that would be.
And it's a lot harder to be sick, than to do this controlled effort. So you either do a controlled effort over time to avoid getting sick, or you hope for the best and then you get sick, and that's a lot harder. And then you lose control. Then it depends on your doctor or your practitioner or healthcare system whether they can even solve your problem, right? So before that, you have the power, but you need to do the effort. There's no way out of that.
Absolutely, absolutely. So Torkil, as we come to a close here, I would love to always ask my guests, especially those like myself, are really into health and performance and longevity. What does your morning routine look like, or what's a non-negotiable for your health?
Non-negotiable is first to have slept well in the night. Make sure that I get those 7 to 8 hours so that when I wake up, my chances of waking up and be feeling refreshed and ready for the day is quite good. And then, depending on how I feel, I may do a cold shower, in the shower with 2 minutes of cold. I may do, I have several different strategies. So I may do red light therapy in the morning. That's preferably in the winter. I will, maybe 20 minutes of, I have a red light panel, infrared light, that I would do. I would make sure that I get light in my eyes as early as I can. And that would be either to go outside or be sitting close to the window, because that would set the circadian rhythm so that it will be easier to fall asleep at the right time in the evening. I would have my cup or two of coffee and not more than that. So after the morning coffee, I usually don't drink coffee because that would disturb my sleep. I used to think that I was a poor sleeper. It was just the caffeine that made that so. So, and I take it easy in the morning. I don't rush out of bed. So that I get a soft start in the morning. So I would say those things would be the most important for me.
Awesome. I love that. Many of the same things I do. A little bit different timing, but I do the exact same things. We mentioned in the bio, I mentioned the camera cure, which is one of your books on photography that you released a number of years ago. And then we've been talking about the pulse cure quite a bit, your most recent book. And we're going to have all of Torkil's links to social media, his website, etc., in the show notes there. Also a link to purchase the book. I just looked yesterday on Amazon. There's actually a sale on it right now. So go get the Pulse Cure on Amazon. We'll have the link there as well. Torkil, any last words of wisdom or golden nuggets, if you will, that you'd like to leave for the audience?
That would be to tell your listeners that we have so much more control of our health and well-being than we maybe think that we have. So that would be the most important, and that these devices and my book can help you to live with more health for a longer time. Yeah.
Love it. I love it. All right, everyone. Thank you for watching the Deepak Saini Show. I'm going to throw it to J23, who's going to guide us out with some music. Also, don't forget to check out today's show sponsor right after. And and there's also a bunch of my resources there. Again, we're going to have all of Torkil's links and everything like that. You can check him out on social media, his website, etc. So again, thank you for listening to the Deepak Saini Show. Remember, exceptional results for the exceptional you. Until next time. Today's podcast sponsor is Bioptimizers, particularly their Mass Zymes product here. I use this every time I have a protein-rich meal or a dairy-rich meal. It's a digestive enzyme product that helps break down proteins from meat, and eggs, etc. You're having that big steak, and also dairy products. You're having the cheese, etc. So I'm very sensitive to these dairy products, particularly some of the enzymes in that. So it helps me break it down so my body can actually use it, and helps break down that yummy steak or ribs or chicken or whatever I'm having, so I can actually use the amino acids from that and help digest that food. So Bioptimizers has like 80 products in their line. I'm just talking about one here, Masszymes. There's Gluten Guardian, which I've talked about before if you're sensitive to gluten. They have nootropics, and they also have my favorite brand of magnesium, Magnesium Breakthrough, that has all 7 forms of magnesium. And I'll talk about that another time. But Masszymes, if you eat meat and you want to get more from your meat, make sure you're digesting it properly and actually get the benefits you want, get those amino acids, then you definitely want to check out Masszymes.
Podcast produced by the Minted Green Company